Carpal tunnel syndrome is what I'm going to be talking a little bit about today. My name's Joss, I'm one of the osteopaths at the Pura Vida Clinic. So carpal tunnel is an entrapment neuropathy of the median nerve as it passes through your carpal tunnel, which is an anatomical little bridge just at the base of the wrist, before it goes on to supply the strength and sensation in the hand. Now, carpal tunnel can result in significant pain in the area that it innervates. It can also result in sensory loss and strength loss, so it's a pretty important one to get checked out. And its effects can range from mild to severe. From the severe end of the spectrum, you're looking at potential surgical intervention or cortisone injection. From anything prior to that, we're looking at conservative management. So that involves physical therapy, whether that's exercises, hands-on, or splinting. And splinting is the one that I wanted to talk to you a little bit about today because it's the easiest one to do. There's a couple of variations, but basically it holds the wrist in an extended position. You've got the carpal tunnel here, and if all of these structures are opened out, then in theory, the improved drainage of that area can help with the pain and the symptoms that you're experiencing. This is something that I tend to advise for nocturnal use, so not in the day. Just when you go to bed, you just pop the splint on at night and take it off in the morning. And this can sometimes be enough to help either relieve the symptoms or even for things to resolve. Once again, my name is Joss Barrett. I'm one of the osteopaths at the Pura Vida Clinic. We provide osteopathic care to Reigate, Redhill and surrounding areas. And if you're looking to discuss your case, do feel free to get in touch with the clinic. You can call us or email us for a call back from one of our practitioners.